What's the recovery time for the tummy tuck? The recovery really revolves around the incision. So this incision is always under tension because we remove a substantial amount of skin and we pull the skin above the belly button down to the pubic region. So the skin is always under the tension. We really need to baby the incision for a good 3 weeks. For the incision, you need to walk bent over. I usually have the patients walk in a flexed position for a week, about 30-45 degrees, and then I still have them walk in a flexed position for another 2 weeks, but like 5-10 degrees. This is to take care of the incision and not put too much tension on it. Swelling is there as well, but swelling is with any other procedure. So for the swelling, you're going to be wearing garments and foams. As far as the drain goes, I've tried both tummy tuck with drains, without drains, and sometimes when I don't remove as much skin, we are able to close off the dead space and not use a drain. Most of the time, close to all the time, I'm going to be using drains to drain out all the extra fluid and help the swelling subside quicker and avoid seromas or other complications which come with the fluid accumulation in between the layers. The drains usually come out in 1 week. Sometimes we keep it a bit longer. With tummy tuck, believe it or not, there's no bed rest. Patients are encouraged and instructed to walk within hours after the surgery. I always send the patients to the aftercare center. So I have the opportunity to come and see them the night of the surgery, evaluate them, make sure everything is good, and see them walk. If you have a desk job, you can easily go back to work within a week. As long as you don't have to drive, and it's okay if you're walking in a flex position. After your 3-week follow-up, when I evaluate the incision once again, you can go back to your work without any limitations. You go back to literally all the routine daily activities, and you don't have to walk in a flex position anymore. In 3 weeks, you're back to all your routine daily activities. Exercise will depend on how quick your swelling subsides. 6 weeks or maybe a little bit longer, 3 months. It depends on how much skin and fat was removed and how your body's responding to the surgery. And my out of town, out of state, out of country patients, they need to stay in town for 9 days. Don't hesitate to check our website, see some results, look at the information, and if you have any questions, feel free to call us.